Beware of complications due to tooth roots left in the gums. Tooth decay is a common complaint. Not infrequently, when visiting the dentist, someone with this complaint asks for his teeth to be filled. Indeed, many people don't realize that the hole in their tooth is too big, leaving only the roots left. In fact, the condition is no longer possible to be saved or patched. The remaining root of the tooth should be extracted. Because this condition is quite dangerous for health, especially in the oral cavity. By removing it, the bacteria or the source of the disease can worsen the condition of the tooth will also be extracted and complications due to tooth roots left behind do not occur. Here are some of the consequences that can arise if the roots of the teeth left in the gums are not removed. 1. Infection. All teeth will grow perfectly, from the crown to the root of the tooth. However, if you can't keep up cleanliness, teeth can be cavities. Tooth decay that leaves the root of the tooth begins as a hole in the crown or an expanding tooth surface. The cause of these cavities, namely the presence of bacteria that gnaws the teeth longer. If the tooth has the remaining roots, isn't it? Means that the bacteria is no longer there, in fact the bacteria are getting more and more on the tooth. From time to time, the bacteria on the remaining roots can become a lot, resulting in inflammation or bacterial infection. This condition will make the gum area around the remaining roots experience swelling. You will also feel a toothache if you are at this stage. If you have experienced such conditions, the dentist cannot immediately perform the extraction action. First of all, it needs to be treated. Treatment that can be done is with medication antibiotics to kill the bacteria causing the infection. After the swelling is gone, then the remaining roots can be removed. Removed to prevent recurrence of infection. 2. Epulis granulomatosa. Epulis is a lesion that is shaped like a tumor. The content of the epulis itself is a proliferation of blood vessels, fibroblast cells, and inflammatory cells. This condition occurs as a result of local irritation or trauma. In addition, the root of the left tooth that is not extracted can also be one of the causes. This disease can be diagnosed by radiological examination. If you have this condition, on radiology it will look in the form of lobes. At the beginning of the occurrence of epulis, you may not feel any symptoms, so it will be very difficult to detect it. Only in the next phase, symptoms of inflammation occur. Sometimes there is also spontaneous bleeding accompanied by pain. The next phase, the epulis will be hard and not easy to bleed. The way to treat granulomatous epulis is surgical excision. But before that, the doctor will perform scaling or cleaning tartar to prevent the spread of infection from tartar. If the epulis is less than 5 mm, curettage and scaling of the area containing the epulis will be performed. 3. Radicular cyst. Radicular cysts or periapical cysts are one of the complications of long-standing tooth roots. This condition accounts for 60% of all cysts that occur in the oral cavity. Generally, radicular cysts do not cause symptoms, so the patient does not realize if there is a cyst in his oral cavity. Cysts can be expressed as radicular cysts based on radiological examination. From the radiological photo, you will see a rounded black shape with a firm border. When the cyst has grown, you will experience swelling. The maxillary incisors and mandibular back teeth are the teeth that most often have radicular cysts. Treatment that can be done on teeth with radicular cysts is root canal treatment and extraction. However, you need to remember, root canal treatment can only be done if conditions still allow. Meanwhile, the cyst can be removed by enucleation or marsupialation treatment. Both methods include minor surgery to remove the cyst. Those are some of the dangers if you let the roots of the teeth remain in the gums. If you have cavities, consult a doctor immediately to avoid various unwanted complications.